little announcements. Not just the Franklin County Democratic Party, but anyone who is concerned about health care, we're having Honk for Healthcare every Tuesday on the square at 5 o'clock. If you want to see our healthcare system expanded to universal health care, if you want to at least just save the ACA, the Affordable Care Act, Obamacare, please join us every Tuesday. We're going to be on the square holding up signs, and we're getting a lot of honks. Our signs say honk to save healthcare, and we're getting a lot of honks. It's really surprising me. Were you there one of the times, Nancy? We've done it 3 times so far.
No, I'm sorry.
That's all right. It's hot. It
was
hot.
Me.
Oh my God.
It was hot, yes.
It was hot, and we were on the sunny side of the square too. So I invite anybody to come out or at least drive by and give us a honk. It's really encouraging to see how many people care about their fellow man and want to see their lives saved, maybe. Also, our next meeting is going to be August 19th. That's a Saturday, August 19th at 9 a.m. in the small meeting room at the Franklin County Annex. That's right next to where the Election Commission office is, on that side of the building. We had our rummage sale, and it was huge. We got a lot of people, a lot of stuff donated. That was a couple of Saturdays ago. That was July 17th. So those are our announcements. Please join us for any of these things. So again, the next meeting we're having is August 19th at 9 a.m. That's a Saturday morning. We usually have coffee and donuts and stuff. And also, show up on Tuesdays at 5. If you listen to the show and you decide, I want everyone to have health care, then show up and help us. The more numbers people see, the better. So I just wanted to sort of, before we introduce our guest, his name is Garrett Adams, Dr. Garrett Adams, and he started the Beersheba Free Clinic, which is in Beersheba Springs, Tennessee. Anyone on earth can go to that clinic and get free treatment. They don't pay a penny. It has an in-house pharmacy, so you don't have to go get your prescription and go somewhere else and have it filled. They will do that. My mother-in-law works there every Monday. It's open every Monday and Wednesday up in Beersheba Springs, Tennessee, and it's all funded by private donations. Generous people helping. And hopefully we won't need that. I mean, it's really wonderful when a person steps up and starts something like that and does all the fundraising for it. But that's just a real spotty here and there. This man just happened to have lived in Beersheba Springs, so he did it there. But we need something like that all over the country, I think. But anyway, so he's the one who started that. He's a doctor in Kentucky right now, but he comes here from time to time. But I wanted to just sort of go back in time. People, a lot of Republicans seem to be longing for the good old days before we had Obamacare. Well, I just wanted to go over, and Nancy, maybe you can help me, and just compare life today compared to 2009, which is right before we got it. So in 2009, you could be denied health insurance for having a pre-existing condition. My husband was one of those people. I'm sure everybody listening to me has some relative or friend who was denied health insurance because of some type of pre-existing condition. And those conditions could be serious ones like cancer or really frivolous ones like acne, I've heard even. All right, so that was one difference today. Today, everyone has to be offered insurance. Number 2, what does EHB stand for? Guaranteed insured health benefits? Essential health.
Yes.
Okay.
Essential minimum.
Right. Essential minimum health benefits. So every policy before 2009, when the law came in, insurance companies could sell junk policies that would only you would pay your premiums dutifully every month, and then when something serious happened, they're like, oh, we don't cover that. And it was often things like pregnancy. Just really common conditions. So now every policy sold in the U.S. has to cover these essential health benefits. These are things like maternity. These are things like I don't know, mammograms, and things that affect men too. I mean, it's not just women's things, but
and many of these preventive care services are actually free with people who have a marketplace policy and go to the doctor that's in the network. There are many free preventive care benefits, regardless of your deductible. If you have and that's big. I've got a list.
I got a mammogram for the first time in my life after that passed because it was covered by my policy.
And doctors can catch a lot of conditions that people have that they didn't know. So that is really big.
Another big difference is that children can now stay on their parents' policies until they're 26. I think my whole 20s, I never once went to a doctor. Not once, because I was working 3 or 4 jobs just to pay the rent and buy my food and buy my car insurance and all that. I didn't have anything left over to go to a doctor. I mean, luckily I never got sick, but now, and I know my kids are definitely going to stay on mine until I turn 26. Okay, the other new thing, which many would argue is a bad thing, and then I kind of agree too, is the individual mandate. Everybody has to have insurance coverage. If not, they pay a penalty to help keep the system going. And that is bad, but you can't just have sick and old people in a pool. A pool has to have healthy and young people in it too. And it's just like car insurance. Would you only sell car insurance to people who've had 5 DUIs? No, you got to have the good drivers mixed in with the bad drivers to even everything out.
Let me jump in on the mandates right there. There are exemptions. People who, according to their income, their level of income, who are determined to be, that they can't afford it, they don't have to pay the exemption. There's a whole list of exemptions if they have special hardships, emergencies, income below the return filing threshold. There's a whole list, and they're found in the IRS code. Because if people can't afford the mandates, they get exempted.
Okay, another thing was the creation of these exchanges. So we have nationwide exchanges that people can go, and this is what Nancy has been so good at, is helping people get signed up for insurance through the exchanges. Another new thing is that if you're a sort of low-income person, but you're not so low income that you get Medicaid, then you will get subsidies to help you buy your insurance. So I know a lot of people are getting subsidies that pay for at least half, right, of the premiums. So a part of the ACA bill was
all of the premiums.
Okay, so that the government is giving subsidies to people so that they can have insurance. And y'all, this saves everybody money. Nobody is served by people showing up at the ER with sniffles. That causes everybody's insurance to go up because the hospitals are, they have to pass on the cost to everybody else. So that's a new thing. Another new thing that we had before is that in the 31 U.S. states that expanded Medicaid, all these working people, people who work at McDonald's does not offer health insurance to their employees. So now all these people who were a little bit too well off to get Medicaid, they weren't destitute, but they were working but they didn't make enough to qualify for the subsidies and the exchanges. They're getting Medicaid expanded to them, and this is rewarding people for working. This is what we want. We want people to work and still get health insurance so that they can show up for their jobs, so they can be well. Another big new thing. So in the 31 states that expanded Medicaid, and we have some right next door to us, that's Kentucky, Arkansas. Kentucky and Arkansas are the only southern states. I think Louisiana is fixing to. But
they talked about it.
But like I said, a lot of states in the U.S. expanded Medicaid, and the ACA is working fine in those states. Where it's failing is in the states where they refuse to expand Medicaid. And that was originally part of the bill, that every state was supposed to expand Medicaid, but John Roberts in the Supreme Court, he struck that provision down.
Right.
And that's one of the biggest things that has caused the ACA to fail.
It entered my mind on the news, just Nashville news, a couple of nights ago. They had a segment on rural hospitals that had closed in Tennessee. And I think it's 9 rural hospitals. That is devastating.
And that's because of not expanding Medicaid.
Everybody in that area. And we have missed out on, Tennessee, hospitals and people have missed out on, by now, it's billions of dollars that we could have gotten had our Tennessee legislature and Governor Haslam approved extension of Medicaid. And that's real. That is happening, and people are going to be having to, in those areas, drive for hours to go to the hospital.
Imagine you're a woman in labor, bleeding or hemorrhaging or something, or you've had a heart attack. What is the difference between driving 5 minutes and driving 40 minutes? It's life and death.
Right.
Life and death. And y'all, elections have consequences. We voted, our state rep and state senator voted against expanding Medicaid. Now, had we voted for someone else, we might have expanded Medicaid in Tennessee. All of our rural hospitals would have stayed open, and people in low-paying jobs would have health insurance right now. So people say, oh, it doesn't matter who you vote for. Yes, it does. Yes, it does. Because our reps and state senator voted to not expand Medicaid, and we're paying the price for that now. So another thing that's different from today and 2009 is that preventive care is covered. All health insurance policies cover preventative care, and this saves money in the long run. When you catch cancer in the very first stages as opposed to full-blown, I mean, it's 1 million times cheaper. If you prevent a pregnancy or prevent any kind of illness, it's cheaper than dealing with the full thing. Okay, another big difference is that we no longer have lifetime caps. I've heard so many stories of people, little babies, who by the time they're 2 have already used up their lifetime caps because they might have some type of rare condition. So that's a new thing because of the Affordable Care Act. More employers must offer their employees health insurance. So if your business is of, I think, 50 employees or more, now you are required to offer it. Of course, I don't think businesses should be burdened with having to insure their workers. That shouldn't be one of their duties. I think businesses find that a huge burden. Okay, and this is one that you rarely hear about. This is the last one I'm going to talk about. Is that before, insurance companies could take your premiums every month, take your money, and then deny you services, deny you procedures, and then spend that money on fancy headquarters, redecorating their headquarters, going on yacht trips with the company, and calling that a company expense. Well, now, because of the ACA, all insurance companies have to spend 80% of what they get from your hard-earned premiums on actual health care, and then 20% they can spend on overhead. So to me, that's a huge new improvement. So they're actually having to give you health care instead of executive compensation. And I just wanted to tell y'all, everybody, all the insurance companies are complaining about how poorly they're doing. Well, the CEO of Cigna makes $17.3 million a year. That's his salary. Do you think he's suffering? I don't think so. The head of Aetna makes $17 million. The head of United Health makes $14.5 million a year, one man. The head of Anthem makes $13.6 million. And the poor head of Humana, all he makes is $10.3 million a year. That's sad. So these guys are profiting big time. This is even since the ACA. They are profiting. Don't you worry. So I just wanted to compare what life was like before the ACA as opposed to now. I do realize that there are some people who have been adversely affected by it, but I would say overall, and that can be fixed. That could be fixed by expanding Medicaid. That could be fixed by a lot of little things.
And you can't be much more adversely affected than to be poor and not have insurance and sick and need treatment and can't get it, or your only alternative
dying is the worst.
or or if you, or your only alternative is to go to the emergency room.
Okay. So anyway, I just wanted to sort of compare now and then. So, all right, we are going to call Dr. Adams now, and we have a few questions for him. So you'll have to review. I hit 1.
Hit the line 1.
Okay.
And then dial.
Okay.
That's all you got to do.
Okay.
Hello.
Hi, Dr. Adams.
Good morning.
Hey, this is Helen Stapleton and Nancy Silvertooth.
Hi, Dr. Adams.
Hey, good morning.
Well, we were just wondering if you could just tell us a little bit about your career. I know that you obviously we all know you're a doctor, but you've also worked in the insurance business?
No.
Oh, okay. I thought you had. I'm sorry. All right. Well, how about you just give us a little quick bio about your career?
Oh. I am a physician. I still have an active license in Tennessee and in Kentucky. I was born in Nashville, grew up there, went to Vanderbilt, and then I went to Wake Forest School of Medicine for medical school, came back to Vanderbilt for pediatric training, and then actually after that we spent about 5 years out west. I was at Los Angeles Children's Hospital and then on the Pine Ridge Indian Reservation as the pediatrician for the Indian children. Got interested in infectious diseases there, took a fellowship in pediatric infectious diseases at the University of Colorado, and from there came to Louisville, Kentucky as the chief of pediatric infectious diseases in the Department of Pediatrics at the University of Louisville, and I had a 40-year career there. About 1984, my wife and I purchased a cottage in Beersheba Springs, Tennessee. My family have been summering in Beersheba since 1850. My grandchildren are the sixth generation in my family to spend summers here. I'm speaking to you now from our cottage in Beersheba, which we bought in about 1984. And after we got closer to the local people, we realized what a difficult situation they were in for getting health care. And as a result of that, we brought together some community leaders and established a free medical clinic here in Beersheba Springs in 2010. So we'll celebrate this November, we'll celebrate our 7th anniversary of providing free medical care here in Beersheba Springs.
Okay.
Yep.
Well, so tell us about the clinic. How is the clinic funded, the Beersheba Clinic?
It's funded entirely through voluntary contributions. Friends and others who are interested and want to support the project have made donations, and we've had a few small grants, but we don't have any government funding, and we do not take insurance. Patients themselves make donations. We have a little donation place with a little metal box with a slit in the top, and they can drop, a few dollars in. And but we provide all necessary medical ambulatory care. We can do most of the usual laboratory procedures on site. We can provide medicines. If patients can make a donation toward the labs or toward the medicines, of course that helps. But probably 80% of our budget is just from voluntary donations.
Right.
This past July the 4th, or July the 1st actually, we had our third annual fun run, 5K fun run, we call it the Dash to the Door, which is a fundraiser, and that was a lot of fun. We had people from all around here for that.
Now, I imagine that and if you could speak up a little louder, that would be great. I'm having a little trouble hearing you. But I imagine that since you don't take insurance, that your overhead expenses are lower because you're not doing all that paperwork. Is that true? Like, what is your ratio of overhead to care expenditures?
Well, that's a good question. Is that better on the volume
yeah,
now?
Much better.
Can you hear me better?
Uh-huh.
Hello?
We hear you.
Yeah. That was the main reason that we chose not to take insurance, was because of the hassle with doing that. We don't do any means testing. I don't actually know. It's a good. You've asked a good question, but our efficiency in the use of our funds is really remarkable. That would be worthwhile looking at specifically. But
well, I've heard with Medicare the overhead expenses are about 3%.
Yes, or less. Yeah.
As opposed to a commercial insurance company. Do you know what the overhead is for them? I guess now it's 20/80, huh?
They can go to 20 without having to pay a penalty.
Right. Okay. All right. The other thing I was wondering is you live in Kentucky. Kentucky's right next door. It's a state with pretty similar demographics to Tennessee, probably a similar economy. Their governor Brashear, expanded Medicaid, and ours did not. Can you sort of compare the two experiences of Tennessee and Kentucky with the ACA Medicaid expansion?
Well, you're exactly right. Governor Brashear got on board early on with the Affordable Care Act, and
he's a Democrat, right?
As a result of that, the Kentucky insured 500,000 people altogether. And,
who had never had it before?
Some did have insurance before, but the largest percentage of the state are covered. I think it's up to 90% are covered now.
Wow.
Unfortunately, there's a new administration that's come in and the current governor wants to do away with the Medicaid expansion, and so that's a terrible thing that could happen. But the ACA, in spite of being a good step forward, has not been what we really need. But to come back to your question, Helen, the difference is huge between the coverage because of the expansion in Kentucky, which did not happen here. It's just such a shame.
Have y'all lost any rural hospitals?
Yes, that's been a.
Well, no, in Tennessee we've lost a lot of rural hospitals. Has that happened in Kentucky?
No,
they haven't been closing.
They're it's a threat. It's always a threat. My interest and my advocacy is for an improved Medicare for All program, which I first learned about in 2003 by reading an article in the Journal of the American Medical Association called "The Physician's Proposal for a National Health Plan." And at the end of the article, there was an option to go to the website and to endorse the plan, and I did that. I think your program is called Common Sense. Is that correct?
Yes,
Common
that's
Sense
right.
Matters, yeah.
Well, that's what I thought this plan was. And that's exactly, when I got through reading this plan, I thought, well, it just makes sense. And so at that time there were, there were 8,000 members of the Physicians for a National Health Program. Today there are over 22,000 health professional members of PNHP. In 2010 to 2012, I was the national president and got to know doctors all over the country who supported the proposal.
So, can I interrupt you one sec, just to make it clear to the audience? Is basically what you're talking about is single payer?
Yes.
Okay. And can you tell us the difference between single payer and single provider? I think a lot of people are confused about the difference between single payer and single provider.
Yeah. The single payer, as opposed to what we have in this country, which is multi-payers, where there are numerous insurance companies and then numerous plans, so that every payment has to be channeled among those plans. An example would be Canada. Toronto General Hospital. Canada has a single payer plan, and Toronto General Hospital and Massachusetts General Hospital have the same number of beds, approximately the same number of beds. Massachusetts General Hospital has 300 billing clerks. Mm-hmm. Toronto General has 3 billing clerks.
Wow.
It's such a simplified system, and
but they offer basically the same type of care, huh?
And the payment is different.
Right.
And
but I'm saying
is a single payer. I've heard that in Chicago there are as many as 37,000 different plans. A friend of mine is an allergist in a pretty good-sized group allergy practice, and they have 7 individuals to do the billing for that group practice. Hospitals in this country have, as I said, so many billing clerks, and the reason for that is that they bill every single patient through a different plan and for every single item. That would go away with the single payer. Now, I should make it clear that what we advocate is a publicly funded but privately delivered health system, an improved and expanded Medicare for all.
So in other words,
that's single. To understand it. If you understand Medicare, we would like to see everybody when they're born in a Medicare system, so that all the medically necessary care is paid for by a health trust. So I could go through some of that if you like.
I just want to clarify one thing just for the audience. So what you're advocating for is single payer but not single provider. So we still have all these private doctor clinics that we have.
The distinction probably is well understood by thinking about the United Kingdom and Great Britain, where they actually have a national health service, and with the national health service, it's similar to our VA, where they own the hospitals and they pay all of the providers directly.
So England is an example of single payer, single provider, and Canada is an example of single payer but not single provider, right?
That's right.
Okay. And because I think what a lot of people in the U.S. think is that if we go to single payer, everyone will have to go to these horrible, gray, bureaucratic, government clinics, and it's going to be like, it's going to look like One Flew Over the Cuckoo's Nest, just grim and miserable. And I think I'm pretty sure we'll just have I'll still take my kids to Dr. Amy over at the right down the street, and she'll have her private clinic. So I just wanted to make that distinction clear, because I don't want people to think we're going to have government-delivered health care. It's just government-paid-for health care.
Yeah,
okay.
That's exactly right. So it's publicly financed but privately delivered. So the provider will still be private providers.
Mm-hmm. So, okay. Did you have a question, Nancy? Well, okay. So the winners and losers in a system like this would be, I guess, if you are a medical biller, you might be out of a job, huh?
Right.
Or if you're a private a private for-profit insurance company, they would be out of a job.
Considered in the bill, the ideas that were incorporated in the physician's proposal, and they were restated this past June of 2016 in the American Journal of Public Health. But what I wanted to say that they are incorporated in House Resolution 676, which is submitted by Congressman Congressman John Conyers, and at this time in the U.S. in our Congress now, there are 115 co-sponsors of this legislation. The majority of the Democratic caucus in the House have endorsed this legislation, which is called Improved and Expanded Medicare for All. And you ask about people whose positions would be displaced by the bill. That's considered in the resolution itself, and specifically stated 2-year salary up to $100,000, first choice in jobs in a new field, and retraining. All of these are included in the bill, so that there would be less, disruption in that respect. Many of the people who are now working in the profit-making health companies will come back into the hospitals, and they're caregivers, and they're nurses and doctors, and instead of sitting at a desk denying care, they will put them back in the hospitals and put them back to work. Giving care instead of denying care. That's great. If anybody has a call for Dr. Adams, please give us a call at 967-2201. If anyone out there has any questions whatsoever about what single payer might look like here in the U.S., give him a call. All you have to do is just look at all the other developed countries in the world, and even some of the not-so-developed countries. Costa Rica has universal health care. Cuba has universal health care. Countries in Africa have universal health care, believe it or not. It's not some weird thing. It's happening right now all around us, all over Europe, everywhere. So it's doable.
I have a question. Dr. Adams, who are the entities that are lobbying most, our Congress, who are lobbying most against this type of coverage?
That's an excellent question, and it's actually the reason that we don't have it, because the ones that the health insurance companies would be number one because they stand to lose because the private health insurance market, commercial health insurance, investor-owned insurance will all go away. And it's through this that we get the largest savings in administrative savings, which would fund the system. There's a 31% loss of income, so, $300 billion through private insurance. I had something in particular I was going to. I have some figures on lobbying expenditures in the United States. This is just for one quarter, that is just for 3 months in 2015. And among the 10 highest lobbying expenditures was the pharmaceutical industry of America at $4.8 million. American Hospital Association, almost $4.8 million. When the ACA was in discussion, Senator Max Baucus, back in 2009, Senator Max Baucus was chair of the Finance Committee, and the person who actually wrote this ACA was a woman by the name of Liz Fowler, who was an official with WellPoint Insurance Company, and then when after this was, she retired and went back to WellPoint. There's a revolving door of people who
lobbyists,
right? And during that time, there was $1.4 million a day spent lobbying by these insurance companies. So, number one, health insurance companies. Number two, pharmaceutical companies. Number three, medical device companies. As far as medical device companies, just to give you an example, McKesson is a very large pharmaceutical distributing company, and they also distribute medical devices. In 2015, the CEO of McKesson's total income was $148 million. So there's huge amounts of money at stake that block the advance of the single payer. Poll after poll shows that our public want the single payer plan, and also there's a majority of physicians in this country who support the single payer plan, and it's growing very fast. There's really a lot of surge in interest. We just heard that President Carter, Jimmy Carter, has come out to say that he thinks we should have a single payer plan. Al Gore the other day endorsed a single payer plan, and as I said, the interest in the Democratic Party is very keen now for a single payer. So I really appreciate the opportunity to talk about it, and I would really appreciate any questions that anybody has about it. Let me add one thing though while I'm thinking about it. It's primarily going to be funded by progressive taxes, and also the influx of administrative savings. But as far as how it would actually affect a given family, a family with $50,000 income will pay an extra $466 in taxes. But
can I interrupt you one sec? That is amazing, because I was just looking back over my taxes for my family of 5. In 2015, my whole family, and we're all healthy, with my insurance premiums and everything we paid, it was $14,000. And in 2016, my family of 5 healthy people paid $15,600. So if I could switch that with $400, boy, that would be fabulous, because I have health insurance and I'm already spending so much on it. And so, yeah, I'd gladly pay $1,000 in extra taxes, or even $3,000 in extra taxes, if it meant not having to spend $14,000 and $15,000 a year for my healthy family. None of us has a disease. All right, I'm sorry, I didn't mean to interrupt you. I'm just trying to put things in perspective for...
Yeah, well, the net savings, of course, in your case, it would be even more. But the figure that I had was that the net savings on average for a family about at that level of $50,000 would be with no premiums, no deductibles, no copays. Net savings would be $5,807.
Wow.
As opposed to $466 increase in taxes. The taxes would be a progressive tax, so that the more you make, the more you would pay. But 95% of people in this country would have more, like you, and like my example. 95% of people will have more at the end of the day than they're spending in increase in tax.
Mm-hmm.
And there's so many advantages of you go to any doctor and you'll carry your insurance wherever you go. If you get sick in San Francisco, you just go to the doctor there.
Mm-hmm.
And as in France, they have what they call a carte vitale, and that card has all of your medical information on it. It has all of your immunizations, it has your blood type and your medical experience, and all the doctor, wherever you go, they just plug it into the computer and they have all the information.
Wow.
And that's the, one of the advantages, just one of the advantages that we would have with it.
I just wanted to mention one of the top 3 lobbyist groups that you mentioned is medical devices. And
yes.
I was reading just this morning, I believe, that this skinny bill that the Senate is considering even today, I believe one of the items that they're going to take out of the Obamacare plan is a tax on medical devices. And then I believe the other one was maybe the mandates. Mandates are unpopular, of course, but we have to have mandates in order for insurance companies to insure everyone. We have to have that 3-legged stool that actually was started by Governor Romney in Massachusetts years ago with the same concept. Everybody gets insurance, no pre-existing conditions. You're not turned down for pre-existing conditions. The mandates, so both well people and sick people can buy insurance, and the subsidies that enable people to buy the insurance. We have to have those, and that concept, that logic was used by Governor Romney years ago in Massachusetts. So they're getting rid of or trying to do something with mandates. Won't work.
But the ACA even is still clunky and very administration heavy, administratively heavy, and a lot of waste is spent on just people pushing a lot of paper pushers. If we go to what Dr. Adams is talking about, a single payer for all simple system, it would be 1,000,000 times more efficient than the ACA.
Right.
And Dr. Adams, our show's almost over, so we're going to have to let you go.
All right. Well, thank you very much. I enjoyed talking to you.
Thank you.
How do I?
All right.
Bye. And Nancy, I saw you had something about ways in which the GOP is trying to sabotage Obamacare. Can you talk about that?
Yes.
Haven't they closed down the centers where people can go?
They have. Well, just recently I've read where, first of all, he has President Trump and company have managed to cut off the enrollment period that starts November 1st. It has been going November 1st through January 31st for people to enroll for insurance starting next year. They've cut that to November 1st to December 15th for people to sign up. I read an article recently that said that they have used money, federal money, our tax money, that was intended to promote enrollment in the ACA. Well, they've used that and made videos making it look bad. And what of course they keep saying Obamacare or the ACA is going to go away. It's not working. What's making in places where it's not working is where they're doing things. For one thing, the uncertainty. The uncertainty at the point we're at now of insurance companies knowing what's going to happen out there. They have to get their premiums for next year approved by September, I believe. And it's all fraught. It's all fraught with uncertainty, and of course they're gonna go with higher premiums if there's any doubt. But if the administration would continue doing what can be done to support the ACA and people having insurance, it'll work. It's been working. It works in Franklin County, Tennessee. I promise you.
Yeah, I mean, I just also I think about small businesses or even large businesses. What a hassle it is for them to provide health insurance to their employees, and what a hassle it is as an employee every time you switch a job, having to switch your health insurance. Imagine if that was just no longer an issue. That would just be really great. I wish we'd get a call, but are we almost out of time here? Okay, it looks like we are. All right, last week my husband got really annoyed with me because I said something that was inaccurate. So I'm going to set the record straight. I said that the U.S. is the richest country in the world, and I got home, he had Googled that. He was like, you can't be saying stuff that's not true on the radio. You can't be doing fake news. So here are the countries that are richer than the U.S. We are, and so what my point was last week, we are the richest country in the world. All these other countries that are poorer than us, like Croatia, Israel, Costa Rica, are giving their people universal health insurance. Why can't we? But we are not the richest country in the world. Ahead of us is Hong Kong, Switzerland, San Marino, United Arab Emirates, Norway, Ireland, Kuwait, Brunei, Singapore, Macau, Luxembourg, and Qatar. But other than those 13 countries, we are the richest country in the world. Those are all tiny, it's weird to think that Ireland was sending millions of people over to the U.S. from the potato famine, and it was so poor, and now it's richer than us per capita. Anyway. Okay, well.
Go march. It makes a difference who we vote for in these elections. I still am appalled that we didn't have Medicaid expanded in Tennessee. As many people as that actually affects, not only living, breathing human beings, but our rural hospitals are taking a big hit, which, of course, affects even people, not just low-income sick people, but everyone who lives in those areas of hospitals. Tennessee needs and has needed that federal money, and our Tennessee legislature,
they don't
turned
care.
It down,
they
and
don't
we
care.
have. You can give them. We've learned through experience. Give them all the examples that you can of sick people. It doesn't impress. I'm appalled at that.
Thank you. Have a good day.
1340 WCDT, Winchester.
Amusement ride tragedy at the Ohio State Fair. This woman, an eyewitness.
The ride, it goes really, really fast, and it goes in circles, and it rocks right to left. And I heard a girl scream help, and I looked over, and I seen something fly out. And then I seen it flat to the ground.
One person was killed, said to be an 18